I want to assure this nation that we know what we are doing. You know? We have many partners. I will give you an example. We've had the challenge of COVID before. We now have the issue of Ebola. But I want to assure this nation that the government of Kenya has made adequate arrangements. We have deployed every arsenal that we have to make sure that we protect Kenya, that we deal with the challenge. We have made preparations for isolation units, for surveillance, for treatment. In 23 counties, we have activated different mechanisms, and different hospitals have been already set up to make sure that if there was a case of Ebola in Kenya, we would know what to do with it. As I talk to the country this evening, we are screening every day any visitor who comes to Kenya. All our borders are on high alert. All our borders, land borders, air borders, are already activated. There is surveillance, there is screening. On average, we screen close to 3,000 people every day who either come to Kenya or are in transit, to make sure that those who show symptoms, we quarantine them, we isolate them, test them. Fortunately for our country, not a single person tested has tested positive for Ebola. And I want to ask leaders and citizens who have any doubt on the level of preparedness by the government of Kenya, that they should not have any such doubt. Our partnership with our friends, the American government, is a partnership that is mutually beneficial to us and to them. When President Trump asked the government of Kenya to support them by having a center in Laikipia Air Base, I gave the okay, because it was an agreement and a partnership with friends who have worked with Kenya for 30, 40 years. The American government has supported us. They have deployed huge resources in Kenya to work with us on HIV/AIDS, to work with us on other diseases. They worked with us on Ebola. In fact, KEMRI was one of the institutions that worked on research on the vaccines for COVID, because we have a solid partnership with America and other partners. So the facility that is at Laikipia Air Base is not a facility different from all the other facilities that we have across Kenya. We have 23 other facilities set up in Kenyatta Hospital, in the police hospital in Nairobi, in Moi Teaching and Referral Hospital in Eldoret, in Kenyatta Hospital in Thika, in Alupe Hospital in Busia, and in many other areas. And these facilities are meant to make sure that there is proper screening And if there is any positive identification of people who have Ebola, then immediately they are isolated, they are treated so that we avoid any spread of the disease. So I want to ask those who are questioning our preparedness or our preparing to make sure that we deal with a challenge if ever it gets to our country. What are they telling us? They are telling us we should not prepare. Are they telling us we should not be ready? And the fact that we could end up with a case is not far-fetched. We have security people serving in Congo DRC. We have thousands upon thousands of Kenyans in DRC. If, for whatever reason, they were to become victims of Ebola, we would have a responsibility as a country to treat them. We would have a responsibility to our citizens to make sure that we take care of them. What the American government is doing is to work with us in partnership to build the capacity to make sure that if ever we needed a facility, that facility will be there to serve the people of Kenya and to serve our friends, including the Americans. And let me say this, for the avoidance of any doubt. This is not the first time we are doing such a facility with partners. During COVID, we built a whole facility. I am wondering why anybody would want to politicize, to mobilize negative politics on a matter so serious as a pandemic. You know, we are a responsible government. We know what we are doing. So people should relax. You know, politicians should avoid reckless, unnecessary talk that doesn't mean anything. I am very confident about what we are doing as a country. I can assure the people of Kenya that the agreement between the government of Kenya and the American government is for the good of our country and for the partnership that friends like the American government have demonstrated to us over time. They have deployed huge resources. They've given us a grant of close to 200 billion Kenya shillings to support the building of our health infrastructure. They've done it before. It's not the first time. They're doing it again because that is the nature of international solidarity. That's the nature of friendship and partnership with people whom you share common values, like the way we do with the American people. So I say this just to make sure that anybody who wants to know what it is, this is from me. The same way I am serious and committed about making sure that every citizen, irrespective of their financial or social status, has access to health. It is the same commitment that involves our commitment to dealing with pandemics, including Ebola.